थोड़ी बहुत, उसके बाद फिर आगे चलेंगे, ठीक है। ये मैंने आपको सब बता दिए थे। अच्छा, यहाँ पे जो चीज रह गई थी वो ये रह गई थी कि हाउ वी विल रीस्टोर द हियरिंग लॉस। हियरिंग लॉस को रीस्टोर करने के लिए जो सर्जरी होती है that is called the tympanoplasty. By definition, the tympanoplasty is a surgical procedure where we reconstruct the sound conducting mechanism, especially the tympanic membrane and the ossicles. I repeat it once again. Tympanoplasty is a procedure by which we restore the damaged conduction of the hearing loss, especially we repair the tympanic membrane and the ossicles. अब ये टिम्पेनोप्लास्टी जो है उसके डिफरेंट टाइप्स हैं। अब आप यूँ एक मिसाल मैं आपको देता हूँ कि अगर एक रोड नवाबशाह से हैदराबाद जा रहा है और नवाबशाह से हाला तक अगर रोड खराब है और हाला से हैदराबाद तक रोड बहुत अच्छा है, तो हम कौन सा पोर्शन रोड का रिकंस्ट्रक्ट करेंगे? नवाबशाह से हाला तक रिकंस्ट्रक्ट करेंगे, पूरा रिकंस्ट्रक्ट नहीं करेंगे क्योंकि आगे तो रिकंस्ट्रक्शन हुई है, रोड बहुत अच्छा है। तो जो रोड अच्छा नहीं है उसको हम रिकंस्ट्रक्ट करेंगे। सो टिम्पेनोप्लास्टी भी इसी तरह है। देयर आर डिफरेंट टाइप्स ऑफ टिम्पेनोप्लास्टीज एंड टाइप 1 टिम्पेनोप्लास्टी is the tympanoplasty where the tympanic membrane is damaged only. When the tympanic membrane is damaged only, we reconstruct that portion of the tympanic membrane. This is called type 1 tympanoplasty. Type 2 tympanoplasty, when the handle of malleus is also involved, then we reconstruct the tympanic membrane and the incus. We will keep the graft between the tympanic membrane and the incus. This is type 2 tympanoplasty. Now, when the incus is also involved, then we will keep the graft between the tympanic membrane and the suprastructure of stapes. This is type 3 tympanoplasty. Suprastructure also होता है head of stapes. But if the head of stapes is also involved, then we will keep the graft on the foot plate of stapes. This is type 5 tympanoplasty. तो इस तरह से different types हैं। अगर सिर्फ tympanic membrane involved है, उस पे graft रख रहे हैं, तो this is type 1. This is also called the mariplasty. अगर head of malleus involved है, तो incus पे रखेंगे, this is type 2. अगर incus involved है, तो stapes suprastructure पे रखेंगे, this is type 3. अगर सुपरास्ट्रक्चर इन्वॉल्व है तो फुट प्लेट ऑफ स्टेपीज रखेंगे, दिस इज टाइप 4. अगर फुट प्लेट ऑफ स्टेपीज फिक्स हो गई है ड्यू टू द इन्फेक्शन, देन वी विल मेक अ होल इन द फुट प्लेट ऑफ स्टेपीज एंड we will keep the graft on that hole. This is called type 5 tympanoplasty. So by stage there are 5 stages or 5 types of the tympanoplasties. Hale quando
click करें ना,
नजर क्लिक So surgical approaches are safe, transcanal and oral, post-oral. मैंने आपको surgical approaches बताए थे. And what are the graft materials which are used in the tympanoplasties? Autograft, homograft, and prosthetic material. Autograft क्या है? Autograft is when we take the graft from the same patient. जिस पेशेंट में डिजीज है वहीं से अगर हम ग्राफ्ट लेते हैं तो दिस इज कॉल्ड ऑटोग्राफ्ट. होमोग्राफ्ट मींस व्हेन वी टेक द ग्राफ्ट फ्रॉम ह्यूमन टू ह्यूमन. ह्यूमन का ही ग्राफ्ट लेके ह्यूमन में ही इस्तेमाल कर रहे हैं तो दिस इज कॉल्ड होमोग्राफ्ट. एंड प्रोस्थेटिक मटेरियल तो आपको पता है कि प्लास्टिक का बना हुआ मटेरियल है जो आर्टिफिशियल होता है. सो ग्राफ्ट मटेरियल्स आर ऑफ थ्री types: autografts, homografts, and prosthetic materials. What grafts can be used in the tympanoplasty? One is the temporalis fascia. There is a fascia over the temporalis muscle in the temporal region of the mastoid bone. We can get the tragal pericardium. We can get the fat from the ear lobule, and we can also get different veins for the graft. So temporalis fascia, tragal pericardium, fat from the ear lobule, and the veins. These grafts can be used as a graft material for the reconstruction of the conductive sound mechanism. Commonly कौन सा graft use होता है? Commonest graft used is the temporalis fascia. Find it. It is the commonest graft which we used in the tympanoplasties. Why this temporalis fascia is commonly used? Because it is very easy to assess and very easy to take the graft from the same incision. अगर हम posterior और post-oral incision दे रहे हैं तो उसी same incision से we can take the graft. So assess is very easy and we can take the graft from same incision. The other incision is not necessary. Color is same as the tympanic membrane, and the most important is that the metabolic rate of this graft, temporalis fascia graft, is same as the tympanic membrane. So when the metabolic rate is same, the take-up chances are about 98%. So in 98% of the people, this graft can be taken easily. So metabolic rate is same. अगर metabolic rate change होगा तो graft take करने में आसानी नहीं होगी, डिफिकल्टी है. लेकिन अगर मेटाबॉलिक रेट सेम है तो ग्राफ्ट टेक कर सकता है और इजीली कर सकता है. अब पेरिकॉन्ड्रियम है सपोज कार्टिलेज, उसका मेटाबॉलिक रेट और टिम्पैनिक मेम्ब्रेन का मेटाबॉलिक रेट सेम नहीं है तो हो सकता है कि ये ग्राफ्ट टेक ना हो और ये रिजेक्ट हो जाए. तो इस वजह से टेम्पोरल फेशिया कॉमनली यूज होता है क्योंकि इसका मेटाबॉलिक रेट सेम है और टेकअप चांसेस बहुत ज्यादा है. Now there are two techniques which are used for the tympanic membrane repair. One is the onlay technique and other is the inlay technique. Onlay technique क्या है? जैसे ये एक होल है tympanic membrane में, यहाँ पे एक हमने ग्राफ्ट लगाया, इस होल के ऊपर हमने ग्राफ्ट रख दिया है. So we have used this graft to the lateral surface of the tympanic membrane. We have kept this graft on the lateral surface of the tympanic membrane. This is called onlay graft. लेकिन यही graft अगर इसके अंदर डाल दें, and if the graft is kept on the medial surface of the tympanic membrane, then this is called inlay graft. So if the graft is used on the lateral surface of the tympanic membrane, this is onlay graft. And if the graft is kept on the medial surface of the tympanic membrane, then this is called the inlay graft. What could be the complications of the ear surgery during mastoidectomy or tympanoplasties? अगर हम एनाटॉमी को देखें तो ये एक ट्रायंगल बनी हुई है, ठीक है जी. इस ट्रायंगल के अंदर ये mastoid enter है. Superiorly, you know that there is a tegment tympani, and we make a hole in this area of the mastoid region. Okay, so by making a hole in this region, if we damage this tegment tympani, then we can enter into the brain. we can cause the intracranial complications. Posteriorly, this one is a sinodural plate, and this sinodural plate contains the sinus. So we can damage this, either the sinus or a sinus plate, and we can do the sigmoid sinus thrombosis and severe bleeding. We can damage this postmeatal wall. This is a postmeatal wall. We can damage this postmeatal wall, and below that postmeatal wall, this facial nerve is running. So by removing this postmeatal wall, we can damage the ossicles that are present here. We can damage the facial nerve paralysis. We can damage the facial nerve, and we can do the facial nerve paralysis. So intracranial complications, sinus thrombosis, and the severe bleeding, the damage to the ossicles, damage to the facial nerve, and the facial nerve paralysis. So these are the commonest complications which we can do during the surgery in the midwife, treatment or in the tympanoplasty. Baba, next की तरफ. Okay, so the next topic today we will discuss is a very small topic but very important topic, and this is called the otitis media with effusion. So what is the definition of otitis media with effusion? If there is a collection of non-purulent serous fluid into the middle ear cavity, non-purulent serous fluid. It is not purulent, mind it. It is a non-purulent serous fluid only. So when there is a collection of the non-purulent serous fluid into the middle ear cavity, this is called the serous otitis media. What could be the etiology for the serous otitis media? One is the eustachian tube dysfunction. The eustachian tube dysfunction. What do you mean by eustachian tube dysfunction? If we have the chronic eustachian tube dysfunction, like eustachian tube opening into the nasopharynx is closed chronically. For example, the adenoids are enlarged. For example, after adenoidectomy, there is the adhesions formation at the opening of the eustachian tube. Number two, there may be the chronic infection of the nasopharynx. There may be the rhinitis, that is the chronic rhinitis, which causes the eustachian tube, chronic eustachian tube dysfunction. There may be the palatal paralysis, which are attached to the eustachian tube. This will cause the eustachian tube, chronic eustachian tube dysfunction. So all, sorry. So this will cause the chronic closure of the eustachian tube opening into the nasopharynx. जब भी eustachian tube opening dysfunction होती है, eustachian tube opening close हो जाती है, तो क्या होगा? होगा ये कि again negative pressure develop होगा. Negative pressure develop होने से serous fluid collection होगी middle ear cavity. So one cause is the eustachian tube dysfunction. Allergy is another cause. Allergy may also cause the eustachian tube dysfunction. Allergic rhinitis may cause the eustachian tube dysfunction again. It will cause the collection of serous fluid. Viral infections. कौन से वायरस होते हैं जो कर सकते हैं? Rhinovirus, most important, which causes the rhinitis. And this rhinovirus again causes the swelling and closure of the eustachian tube. Cleft palate. Because the cleft palate muscles are attached to the eustachian tube. When there is a movement of the palate, these muscles contract and relax. And when they contract, the eustachian tube opening becomes open. When they relax, the eustachian tube opening becomes closed. So whenever there is a cleft palate, these muscles cannot contract and relax. So there is the closure of the eustachian tube. And the last one is the unresolved otitis media. If there is an otitis media, suppose if there is an acute otitis media, and we have given the antibiotic, but that antibiotic is not sensitive against the proper bacteria, or the antibiotic is given for a lesser period of time, then नहीं उसको 10 दिन थी और आपने दिए 3 दिन, तो क्या होगा? This purulent fluid which is present into the middle ear cavity, it will become sterile due to the use of antibiotic, and this sterile fluid is just like a serous fluid into the middle ear cavity. So these are all the causes for the otitis media with effusion. What could be the clinical features? There may be the deafness. Which type of deafness? The conductive type of deafness. Whenever there is a deafness, always there is a tinnitus. What is tinnitus? Tinnitus are the abnormal sounds into the ear. So conductive deafness and abnormal sounds into the ear, which is known as tinnitus. Number 3, there will be the heaviness in the ear, and patient feels that some water is present into the ear due to the collection of the fluid behind the tympanic membrane. And there are the hissing sounds which the patient feels due to the presence of the serous fluid into the middle ear. So deafness, tinnitus, feeling of water into the ear, and the hissing sounds. These are the symptoms. When we see the patient and we will examine the patient, there will be the retracted tympanic membrane. The tympanic membrane will be dull, lusterless, and anatomical landmarks you cannot see. So this is the retracted tympanic membrane, and you can see the fluid into the middle ear also. How? Now this is a picture of the typical serous otitis media. This is the tympanic membrane, and behind the tympanic, this is the handle of malleus. You can see it, handle of malleus, and you can see the bubbles. These are the bubbles. Why these bubbles are formed? Due to the mixing of the air and the fluid. This mixing of the air and fluid, किसी भी fluid में अगर आप air mix करेंगे, जैसे पेप्सी कोला में अगर आप air mix करेंगे तो bubbles बनेंगे. तो इसी तरह से इस fluid में भी जब air mix होती है तो bubbles बनते हैं. So you can see these bubbles behind the tympanic membrane, and these bubbles are due to presence of the serous fluid into the middle ear. दूसरा जो है, this is the hairline. This is a hairline. This is the normal tympanic membrane. This is the tympanic membrane behind which there is a collection of fluid. You can see the bubbles behind, but there is a line of demarcation between the normal tympanic membrane and the tympanic membrane which contains the fluid. So this is called a hairline, and this hairline will always be present when there is the serous otitis media. So the bubbles behind the tympanic membrane and the hairline in the tympanic membrane, which runs horizontally through the tympanic membrane, these are two important signs for the diagnosis of the serous otitis media. Now, what could be the investigations that you can do in this patient? One is that pure tone audiometry. Why you take the pure tone audiometry? When you take the pure tone audiometry because you want to ascertain that whether there is a conductive hearing loss only, or there is a sensory neural hearing loss only, or there is the mixed hearing loss. So in these 3 hearing losses, you want to distinguish between the conductive hearing loss and the sensory neural and mixed hearing loss. So for that reason, you will go for the pure tone audiometry. Second is the tympanometry. Tympanometry क्या है? Tympanometry is the procedure by which we, via the instrument, we can ascertain by a graph, one, the middle ear pressure. You can see the middle ear pressure. You can see the compliance. Compliance क्या होती है? जो movement होती है tympanic membrane की, जो movement होती है ossicles की, और साउंड कंडक्शन की वजह से जो मूवमेंट बनती है उसको हम कंप्लायंस कहते हैं। कहते हैं ना कि बाबा ये बंदा जो है वो बड़ा कंप्लायंट है, इसको मैं जो भी काम करता हूँ वो फौरन कर देता है। So we want to see the compliance of different structures which are connected for the conduction of sound. So tympanometry gives you two most important things. One is the middle ear pressure. Second is the compliance of the structures which are present into the middle ear cavity. And uh, uh, these two things are very, very important as far as the serous otitis media is concerned. Now this is the graph of the tympanometry. When we use the tympanometry, this type of the graph you can get. This is a normal graph. This is minus 400, minus 200, 0, plus 200. The normal pressure of the ear क्या होता है? Ear का pressure ear में normal हमेशा 0 होता है. This is 0 pressure. अगर आप यहाँ से यहाँ line खींचे तो ये line हमेशा 0 पे आती है. So the normal pressure into the middle ear is always 0. So if this now this is the peak of the graph. This one. This peak of the graph is at 1. This is 1.5 centimeter. And this is 1. So if the peak is on the 1 and the graph is at 0 millimeter of Hg, millimeter of mercury, so it means that the middle ear function is normal. If the compliance is at 1 and the middle ear pressure is 1 centimeter square and the middle ear pressure is 0 millimeter of mercury, then this is called a normal middle ear function. Lekin, if there is a collection of fluid inside, if suppose there is a eustachian tube dysfunction, there is a retraction of the tympanic membrane, then what will happen? The middle ear pressure will be towards the negative side. Means it may be towards minus 200 or towards minus 400. So the graph will be like this. This will be the graph. Right? So the pressure is, or this will be like this. So the pressure is minus 200 and compliance is also reduced. So if the graph is towards the negative side and the compliance is also reduced, then this is called eustachian tube dysfunction graph. But suppose there is no graph and there is a straight line like this. It means that you cannot detect the pressure, you cannot detect the compliance is 0, and you cannot detect the pressure of the middle ear. It means that the fluid is present into the middle ear cavity, so that for that presence of fluid, you cannot ascertain the middle ear pressure, and due to that fluid, the compliance is 0. So there is a flat graph. So you can take this flat graph on the tympanometry when the fluid is present into the middle ear cavity, and you can take this graph at the 0 pressure of the middle ear cavity and compliance at 1 centimeter square. Then this is a normal middle ear function graph. Now this is actually the graph of I have told you the audiometry, the pure tone audiometry. Now in the pure tone audiometry, we take two graphs, one for the bone conduction. अगर आप जो है वाइब्रेटर बोन पे रखेंगे तो आपको बोन कंडक्शन मिलेगी, और अगर वाइब्रेटर कान पे रखेंगे तो आपको एयर कंडक्शन मिलेगी। तो ये दो चीजें हैं, ये बोन कंडक्शन का ग्राफ है, ये एयर कंडक्शन का ग्राफ है। बोन कंडक्शन का ग्राफ हमेशा 20 पे नॉर्मल आता है, दिस इज 20, ये 20 पे नॉर्मल आता है। एयर कंडक्शन का ग्राफ भी इसी के साथ 20 पे नॉर्मल आना चाहिए, लेकिन अब क्या है, बोन कंडक्शन ग्राफ तो 20 पे है, एयर कंडक्शन ग्राफ जो है वो डाउन हो गया है, नीचे हो गया है। मींस ये देयर इज अ लॉस ऑफ कंडक्शन, there is a space between the bone conduction and air conduction. So when the bone conduction graph is normal, air conduction graph is reduced, and there is a gap between the air conduction and bone conduction. This is called the conductive hearing loss. I repeat it once again. When the bone conduction is normal, number one, air conduction is reduced, number two, and when there is a space between the bone conduction and air conduction, number three. When these three things are present, this graph is called the conductive hearing loss graph. I hope you are clear. So whenever there is the serous otitis media, what could be the treatment in the last? The one and most important thing is that the Eustachian tube function should be restored. अगर Eustachian tube function restore कर देते हैं तो फिर किसी ट्रीटमेंट की जरूरत नहीं है. अगर एडिनॉइड्स की वजह से है तो एडिनॉइडेक्टमी करते हैं. अगर एलर्जी की वजह से है तो एलर्जी को ट्रीट करें. क्लेफ्ट पैलेट की वजह से है तो क्लेफ्ट पैलेट को रिपेयर करें. So all these predisposing factors should be treated first. In the meantime, when you are treating the predisposing factors, you should also give the steam inhalation so that आपके rhinitis की वजह से जो नाक बंद हो गई है, there is obstruction, there is edema in the nose, that should be relieved by steam inhalation. You can also use the nasal decongestant drops. That will also decongest the mucosa of the nose and the nose will become open. And when the nose is open, the nasopharynx is always open, and when the nasopharynx is open, the opening of the Eustachian tube is open. So the first thing is that treat the predisposing factors. And with this treatment, you give the steam inhalation and nasal decongestant drops. अगर इससे काम हो जाता है तो well and good. There is no use to give the antibiotics, because if you use the antibiotic, it is useless because it is not a bacterial infection. It is only the collection of the sterile fluid, serous fluid, into the middle ear cavity where there is no infection, and it is always due to the closure of the Eustachian tube and decreased ventilation is the main cause. So treat the predisposing factors and open the Eustachian tube opening so that there will be the aeration of the middle ear cavity. Steam inhalation and nasal decongestant drops. अगर ऐसे काम नहीं होता तो मोस्ट इम्पोर्टेंट चीज ये है कि जो फ्लूइड मिडल ईयर में पड़ा हुआ है, जो एक्सक्रीट नहीं हो रहा, उसको हम निकालें एक चीज, और दूसरी चीज हम उसको एरिएट करें मिडल ईयर कैविटी को. जैसे एयर अंदर जाएगी मिडल ईयर कैविटी में तो ऑटोमेटिकली जो फ्लूइड है वो एक्सक्रीट आउट हो जाएगी. So we will do the laryngotomy. What is the laryngotomy? And we will go with the insertion. So now this is the procedure of the laryngotomy. You will give the incision into the anterior inferior part of the tympanic membrane. When you will give the incision into the anterior inferior part of the tympanic membrane, you can remove all of the fluid which is present behind the tympanic membrane in the middle ear cavity. So give the incision into the anterior inferior part of the tympanic membrane and remove the fluid which is present in the middle ear cavity. So this is called the laryngotomy. After laryngotomy, you can put this grommet. This is called a grommet. This is basically a ventilation tube. And after giving this incision and removing the fluid, you will put this grommet into this incision. One opening will be outside and one opening will be inside, so that the air should go from the outside opening towards the inner side opening and towards the middle ear cavity. We need aeration. It will be like this. So this is called the grommet insertion. Now, these are different types of grommets, but this grommet is used commonly here. One opening and there is the other opening. So this opening will be outside the tympanic membrane and this opening will be inside the tympanic membrane. So the air can pass from the exterior to the middle ear cavity. And we need the aeration. For that we keep this grommet inside. और ये grommet कब तक रखेंगे? ये grommet will be removed automatically when there is the healing of the fibrous tissue which is present into the tympanic membrane. These fibrous tissues, there will be the healing of these fibrous tissues, and whenever there is a healing, the opening will become smaller and smaller and smaller, and after about 6 months, this ventilation tube will come out by itself, and the whole of the tympanic membrane opening will be closed automatically. But if within 6 months this tube is not removed by itself, then we have to remove it under the local anesthesia. Just grip it with the forceps and take it out. It's a very easy job, and we can remove this grommet after 6 months. So this is all about the treatment and grommet. This is a grommet which is present into the tympanic membrane, and you can see the handle of malleus, and we have given the incision here in the anterior part of the tympanic membrane, and we have put this grommet so that you can see the middle ear portion here from this opening, and the air will go from this opening to the middle ear cavity. This is the main treatment of the serous otitis media if it is not relieved by the medications. So this is all about it. And next time when I will take the lecture, I will take the lecture on the complications of the chronic suppurative otitis media. So I'm going to unmute you, और उसके बाद जो है वो मेरी आवाज आ रही है?
सर टिम्पैनोमेट्री वाला ग्राफ रिपीट कर रहे हैं?
क्या वो डिफिकल्ट है?
सर रिपीट करें.
ओके ओके, मैं ट्राई करता हूँ. एक मिनट. ये जी देखिए, ये टिम्पैनोमेट्री का आपका ग्राफ है. ये देखिए, ये इसकी पीक जो आ रही है, ये आ रही है 1 पे. ये 1.5 सेंटीमीटर स्क्वायर है, ये पूरा ग्राफ है. लेकिन इसकी पीक यहाँ पे आ रही है और ये कहाँ पे 1 सेंटीमीटर स्क्वायर पे. तो अगर पीक आपकी ग्राफ की 1 सेंटीमीटर स्क्वायर पे आए और ये 0 मिलीमीटर ऑफ Hg पे ये ग्राफ बन रहा है, इट मींस इट इज नॉर्मल. लेकिन अगर ये ग्राफ बन ही नहीं रहा और बिल्कुल फ्लैट लाइन नजर आ रही है, तो दिस विल बी दी serous otitis media. अगर यही ग्राफ अगर हम जो है वो यूं करके बनाए, सपोज यूं, तो इसकी पीक आएगी यहाँ पे, इस पे 0.5. तो 0.5 पे पीक आ रही है और प्रेशर आ रहा है -200 पे, तो ये होगा यूस्टेशियन ट्यूब डिसफंक्शन का ग्राफ. इट मींस दैट यूस्टेशियन ट्यूब क्लोज है, नेगेटिव प्रेशर आ रहा है. क्यों आ रहा है? -200 इज नेगेटिव प्रेशर. नेगेटिव प्रेशर इन द मिडल ईयर ऑलवेज व्हेन देयर इज द यूस्टेशियन ट्यूब ऑब्स्ट्रक्शन. आई होप आपको समझ आ गई होगी.
जी सर, थैंक यू.
Any other question? So inshallah next time we will go on the complications of chronic suppurative otitis media. And thank you very much.